Kani kadega batisi TV, bat pidang pet yaki kubor baman kasni, balwan rasha pida ka orange nisan, lom so po niya fabricate shillong.
Nado ba ukunyang Jingpang COVID-19 ulayo bandrong hakani kajela Meghalaya, hakani nong ba shillong. Kiba bon ginong susnong kajela, kiba layatin ko kam baru Dr. John L. Halor rentatiang, ne kiba larong lami ha Bethany Hospital shillong, nado ka arpo artrek ubnalaber mentausnam arajar arpo sheneng. Kila pentep bat register ilade bat ke 108 kumjo bat ketnat ke koi kekia. Kajing benyau jeng kiba bon pat ke longru, ba wat hadien ba kila pentep, empat lale ya ketes yaki. Mano badan kam menle ya kini ketes Halor ukunyang Jingpang COVID-19 bat mano bam dan kam menle haka kat praterek mentob na yayong arajar arpo u menteri rangba kini kejela Meghalaya u Conrad kongkal Sangma u lakren Pynshai Halor kini kebenta.
Now a lot of people have called us and asking us about why they have not been tested in spite of them making calls. Friends, we need to remember that we need to prioritize the testings. Therefore, the protocols are as follows. Number one, the high-risk primary contacts, those who lived in close proximity and contact with the positive patient, are the high-risk primary contacts. The next level will be other symptomatic primary contacts. These are primary contacts who have been in close proximity with the concerned individual. And third are symptomatic high-risk individuals who have visited the concerned hospital after 24th March and have registered with the government. And these are more of individuals who met with the person directly. All asymptomatic cases and asymptomatic individuals who have visited Bethany Hospital after 24th of March 2020 and have registered with the government are not being tested currently. All these individuals, however, have to be mandatorily under home quarantine for at least 14 days. And in case they develop any symptoms, they should immediately call 108 and report. We also, as you're aware, we also had one case from one suburban area of one person who was working in the house of the index patient, and the samples of the 4 high-risk primary contacts and 32 other primary contacts of the person who has tested positive have already been collected. The village community, led by the headman, has decided that all the above contacts will be kept under strict home quarantine in the village with the support of frontline health workers and the community. Apart from that, visits have been made by the health officials and by the block to the concerned village to ensure that they instill confidence in the villagers and the family concerned. The second issue that I would like to discuss with you is regarding the case management protocol. And this is to do specifically with people who are confirmed cases. Number one, all asymptomatic category A and mild symptomatic category B positive patients do not require hospitalization. As per the protocol issued by the Health and Family Welfare Department, they should be under home quarantine or they can opt to be shifted to a government designated Corona Care Center by calling 108. In case they do not have a space for themselves to self-isolate at home. Friends, the existing evidence shows that about 80% of the positive cases across the world fall in this category. The second are severe and symptomatic cases having respiratory distress, breathing difficulty, and requiring oxygen support. This is called category C, and they would be treated at all the designated hospitals. Number 3 are severe symptomatic cases with other comorbidity conditions and requiring ventilator and ICU support is category D, would be treated at designated hospitals having such facilities like the Civil Hospital Shillong, Negrims, Dr. H. Gordon Roberts Hospital Shillong, Supercare Shillong, and Nazareth Hospital. Therefore, friends, just to clarify to everyone, anybody found positive is not necessarily need to be put in a COVID hospital. As mentioned, 80 to 85% of these people are mild cases with very mild symptoms, and they can be easily treated by simply quarantining themselves either at home or in a corona care center. It is only the cases with category C that require some help, which are basically having some distress and some breathing problems, have to be treated at designated hospitals, and only the severe cases which are having need ICU support are the ones that need to be taken to the COVID hospitals, who will require the manpower. And friends, this is being done throughout the country and throughout the world. And the main reason this is being done is because the management of the patients who are positive is very critical to ensure that all the facilities and infrastructures are used in the best and the most efficient manner. And that is why these protocols have been set, and these are the protocols that we are following as of now.